এই নির্জন বরফ পথে আমি তোমার জন্য বিছিয়ে দিয়েছি অনন্ত উষ্ণতা। তুমি যখনই পা ফেলবে তোমার প্রথম পা পড়বে আমার আবেগের লাল গালিচার উপর। অনন্ত বরফ পথে আমি তোমার জন্য বিছিয়ে রেখেছি উষ্ণ হৃদয়। তুমি চলে এসো। আমার জন্য আপনারা উষ্ণ হৃদয় বিছিয়ে রেখেছেন কিনা জানি না, তবে আপনাদের হৃদয় উষ্ণতার বলয়ে ঘিরে দিতে যথাসময়ে আমি চলে এসেছি সাজবেলা নিয়ে। সবাইকে আমন্ত্রণ আজকের সাজবেলায়। দর্শক, আজ আমাদের মাঝে সাজবেলার অতিথি হয়ে এসেছেন আন্তর্জাতিক খ্যাতিসম্পন্ন চিকিৎসক সিঙ্গাপুর থেকে আগত ডক্টর চিউ সো পিং। তিনি বর্তমানে পার্কওয়ে হেলথ অর্গানাইজেশনের মাউন্ট এলিজাবেথ হাসপাতালে সিঙ্গাপুরে কর্তব্যরত আছেন। চলুন কথা বলি অতিথির সাথে। Very good evening and welcome to our show.
Good evening. Thank you for inviting me to our stations and visiting Dhaka.
Okay, how are you?
I'm very fine, thank you.
Being a doctor, you are serving a noble job. So I would like to know that how you got into this profession.
It's an interesting question.
Okay.
I can remember as a child, somehow I always wanted to become a doctor. And after I finished my high school, got into medical school, and it was during the medical school days that I sort of fell in love with surgery.
Okay.
Because I'm a person who likes to work with my hand, and that's how I become a surgeon. And hopefully with my hand, I can help my patients to get better.
You yourself decided to become a doctor.
Yes.
Do you enjoy your profession?
Oh yes. I mean, as for any profession, there's always up and downs. There are times when we are down and we say, why am I in these situations? But at the end of the day, when I look back, if you ask me again, would I get back to the same professions, the same job? My answer would be a very firm yes. Because as a surgeon, it's very satisfying when we do our best for the patients and we see the patient get well, go home and enjoy a new life again. And nothing can beat that thought satisfactions. So I would still choose to become a surgeon if you give me a second chance.
We know that you are a senior consultant surgeon in laparoscopy. So would you like to share a few things on laparoscopy with us, with our viewers?
Yes, laparoscopy is not that new, but it's been around. And the problem with surgery is that many people, they visualize surgery as in a big cut, a lot of bleeding, a lot of blood loss.
Yeah.
A lot of people are very fearful for surgery. And these days, the younger patients are very conscious about their appearance.
Okay.
So they want to have smaller scar, nice scar. And all patients don't like to suffer pain. Bigger cut means more pain,
Bigger pain.
longer to heal. And laparoscopy offer all these advantages. Smaller cut, less pain, and maybe less bleeding. The advantage of laparoscopy is beyond that. By putting a small telescope through a small hole or small incision in the belly button, we can actually enlarge the view. We can see better. By using instrument to do the surgery, we can be more precise, and surgery can be conducted in a very smooth and a very well controlled manner. One typical example would be laparoscopic surgery for gallbladder stone disease.
Yeah.
In the past, patients have a 6 to 8 inches cut in the tummy, had operation done. They stay in the hospital for maybe 3 days, 4 days, and they take 4 weeks, 6 weeks to have fully recovery. But nowadays, with laparoscopy, we put a small camera through the belly button and a few small instruments. We can complete the surgery and patient can go home the next day. Usually by the end of 1 week, they are back to normal activity, including doing their sports. And that is very, very attractive. As for us, of course, doing surgery with long instrument and doing surgery with video images is a little bit more difficult.
Yeah.